Bismillahirrahmanirrahim. My name is Dr. Fakhar Hayat. You are watching our YouTube channel Medicose Fever. Today we will discuss the most important of the cardiac system is the cardiac pathology. Firstly, we will discuss about the angina. What is the angina? Angina mainly is due to chest pain. Here this is our chest and this is the left side of the chest. There is a left side of the chest pain due to reduced blood flow. Firstly, in case of the normal heart and the artery, this is the artery and this is the heart. Artery of the heart is a coronary artery and there is a blood flow of the coronary artery towards that area. And there is a normal heart. In case of the pathology or the plaque formation, there is a atheroma or the plaque formation and there is a reduced blood flow. In case of the reduced blood flow, there is mainly and there is a other cardiac muscle supply to the other cardiac muscle decreases. Then that can lead to the chest pain due to reduced blood flow. I want to just discuss about the types of angina. This is the normal coronary artery, and in case of three types, stable angina, unstable and the variant angina. In case of the stable angina, there is a formation of the atheromatous plaque formation. Here this is the mainly I am discussing about the coronary artery. This is the coronary artery and atheroma formation. Here is the formation of the atheroma and blood flow towards the other area. Here in case of the blood flow is reduced. This is the atheromatous plaque formation and blood flow is reduced. In case of the unstable angina, both this is the formation of the atheroma with blood clot formation. Here formation of the blood clot. In case of the variant or vasospastic angina due to the coronary vasospasm, here this is the artery of the coronary artery, smooth muscle contraction. If smooth muscle contraction, it mainly covers the whole of the artery. That's why it's called transmural, covering whole of the lumen. That's why this is called as the vasospastic angina, or its different name. Some of it is called as a variant angina or other called as the transmetal angina. Firstly, we are discussing about the phases. Firstly, the patient is the asymptomatic. There are no symptom appears. In case if more than 70% of the coronary artery is blocked, that can lead to the chronic stable angina. Chronic stable angina mainly occurs at the rest phase. Mainly occurs at the phase of the these do not occurs at the rest phase, but on the exertion they occur on that side. That's why it's name called stable, because angina is not occur in the rest state, but in case of the exercise this can be happened. Unstable angina, it mainly occurs at rest. That can lead to the progression of the myocardial infarction. Here in three cases, asymptomatic, chronic, stable angina and unstable angina, there is no necrosis of the myocytes, cardiac myocytes, no necrosis. But if there is a complete occlusion of the coronary artery, no blood flow. If there is a no blood flow, that can lead to the myocardial infarction, then the congestive heart failure, that can lead to death. That's why we are discussing again three types. Stable angina, it cannot occurs at rest. First MCQ. Then the most important is it occurs during exercise, emotion, cold and eating. It mainly lasts for 1 to 15 minutes and gradually to the maximum and revealed by rest. If we are taking exercise, there is a stable and chest pain, but if we wanna take a rest, then stable angina can be reduced. And other way is the sublingual nitroglycerin on the sublingual side. This is the medicinal sublingual nitroglycerin. Variant angina, it occurs mainly at rest due to vasospasm of the smooth muscle contraction. In case of the unstable angina, what is the unstable angina? It also less than 20 minutes. It also less than 20 minutes, but is the extreme form of the stable angina. If it is greater than 20 minutes, in the next video we will discuss about the cardiac myocardial infarction. If it is greater than 20 minutes, can lead to the myocardial infarction. Here on the ECG we are discussing about the ST segment depression and elevation. Here is a normal ECG diagram. There is a P wave missing normally, but this is normally present, but he has not shown the P wave. This is the long QRS complex. Then this is the ST segment, and this is the T wave. In case of the subendocardial ischemia, when we are discussing about the atherosclerosis plaque formation, this is the mainly it has three layers. I wanna just discuss it has three layers. I wanna show to the three layers. This is the mainly endocardium, then myocardium, then epicardium. In case of the subendocardial ischemia, subendocardium involved, there is a ST segment depression. ST segment here, this is the ST segment, it is depressed. ST segment, this is depressed, but it is horizontal, and this is the down slope like structure. But in case of the transmural ischemia, that can lead to the ST segment elevation. What we are discussing about a transmural? If there is a smooth muscle vasoconstriction, there is a covering the whole lumen, endocardium, myocardium, then the pericardium. This is called as the transmural ischemia, and this is the variant, or you are asking about the prismatic angina. There is a ST segment elevation. The most important MCQs in the USMLE exam: if there is a stable angina, there is a stable or unstable angina, there is a ST segment depression, and ST segment elevation mainly occurs in that of the which type of angina. This is, you should on a tick on that point, that are the prismatic or variant angina. That can also occur in the myocardial infarction we will discuss later on. Thank you so much. Jazakallah. Allah Hafiz. Please like and subscribe our channel Medicose Fever, and remember us in your prayers. And thanks to my team, the Medicose Fever, which are more curious about it. And thanks a lot. Allah Hafiz. Take care.